I am Dr. Jerry Hesch, a physical therapist from the Hesch Institute in Aurora, Colorado. And you can look at my website, heschinstitute.com, spelled H-E-S-C-H. And I consider myself a sacroiliac expert. I've worked with it for 35 years and developed my own system of treating it. And my client Jolene has a 20-plus year history of sacroiliac joint dysfunction, and basically goes for adjustment, would you say every single week?
Oh, no,
or
but
a couple times a month?
6 times a year, typically.
Oh, is that right?
Mm-hmm.
Okay, alrighty. What part of the year are you without symptoms?
Not very many parts of the
Not
year.
many.
Yeah.
And you've certainly explored a lot of different therapies, 24 visits of prolotherapy. You've seen multiple physical therapists, multiple chiropractors.
Yep. Orthopedic surgeons.
Okay, alrighty. And most recently in November you bent forward and twisted and caused the most recent setback.
Yes.
And you haven't been able to get out of it. The adjustments just haven't worked.
Right.
Okay. In her x-ray, it's interesting to note increased width of the lower part of the pubic joint. And when I looked at her x-ray, I immediately was drawn to that because it certainly looked different than most x-rays. So we think that she has a little bit of hypermobility. That is structural. And that correlates with increased mobility when I do a spring test on her pubic bone. So what I'm going to do is put my thumb, if you can capture my thumbs here, on each pubic bone, and I'm going to push posteriorly, and just like this anatomical model, she has increased mobility. And so we'll go to her body and we'll do that test. So we walk down from the belly button downward to find the pube. And the top of the pubes are symmetrical, and we allow about 2 to 4 millimeters of width and make sure that I'm on something that feels bony. And I walk across the pubic joint, and there's no step off, and I'm on the middle of the joint. And now I'm on the lowest part of the joint, and there's no step off going side to side. Now I'm on the middle of the joint, and this is movement. You might have to come much closer, I don't know. But this literally is posterior shifting of about 1/4 of an inch. Do you feel like you can see that with the camera? Okay. So I'm going to bring my left thumb in to match my right thumb. So I'm over the pubic cartilage, but my left thumb is on the pubic bone. Can you see that depth? Okay. This is quite rare to find someone with pubic instability, and the same phenomenon is on this side. So certainly one approach to treatment is going to be to wear not a sacroiliac belt, but I'm going to name it a pubic joint belt. And it's going to be worn down low at the level of the trochanters and the level of the pubic joint. And she's going to wear that for 3 months. I think we'll get a lot of benefit very quickly. And you don't have to wear them all day. You can wear it a couple hours and then take it off. You'll still get a lot of benefit from it. And it needs to be snug but not too tight, because then you're going to get a sensory nerve injury, you know. If you start to get tingling or numbness, it's too tight. Loosen it or take it off. But make an experiment and see how well you tolerate it. Maybe you only want a half hour on, I don't know. But see what you can do and wear it throughout the day. You can use it intermittently, and a little can do a lot of good.
And at night, right?
Well, you could. I usually don't tell people to wear it at night.
Okay.
But do the experiment.
Yeah.
See if that works. See if it helps you. And there is good research that people do heal when people have some separation in the pubic joint and they use that belt. If you were an inch wide or more, then you would fall into the category of surgery. There's only 2 cases in the medical literature of people with a greater separation than that healing with use of the belt. okay? Only 2 cases, but they didn't fully close, you know, and I don't know what their long-term symptoms were after that. Clearly they were much better, but to what, you know, did they make a full recovery? I don't know that. But this is a very interesting presentation on the pubic joint, and I'm really optimistic that that belt is going to help you in a period of 6 to 12 weeks.
Okay.
Okay? You also have a lower pelvic movement dysfunction. Let's have you lie on your stomach and we'll demonstrate that. When I do all the traditional palpation of the ASISs and the PSISs and palpate along the sacrum and palpate underneath the ILAs of the sacrum, palpate under the sit bones, palpate the top of the pelvis, you only have a subtle asymmetry. It's really subtle in which the right hemipelvis is a little bit higher. That could be developmental, but when we, and we also do passive spring testing, and you have excellent mobility throughout the pelvis. And we did this with you laying on your back as well. And here's a superior spring. Here's a superior spring. Here's forward rotation. Here's inferior glide. And that force translates through your SI into your hip joint, into your lower leg. Your sacrum has good mobility. I spring it, and you can see the heels. Can you capture the heels bobbing? You see that motion in the heels? And that's from springing the sacrum. And now I'm at the middle sacrum, now I'm at the top of the sacrum, and now I'm springing each quadrant. What's interesting is then when we come down to the sit bones, and I'll show you on the skeleton here, on the anatomical model. When I come to her sit bones, I find that they are shifted to the left. So the right sit bone, this is her, let's come over here. Her right sit bone is closer to the midline. Left sit bone is further away from midline. Okay, so we're defining midline as the midline crease of her buttock. So when I come with my thumb in here, and I come with my thumb in here, you can see that the crease of her pants matches the anatomical crease. That's a significant difference. Can you see that difference through the camera? Okay. And then when I come onto the sit bone here and I try and spring it towards midline, it's stuck. When I try and spring this one outward, it's stuck. When I try and spring in on the right and out on the left, they're all stuck. So they're stuck at end range, and this is a pattern I discovered, and I call it lower windswept pelvis. And it's based not on how it looks, but it's based on the fact that it doesn't move. So I'm trying to take up the slack, and I'm trying to spring it, and there's no give with a reasonable amount of force. I'm sure if I put 80 pounds, I'm sure, you know, her whole body would move, but with a typical amount of force used to take up the slack, there's no give. And there's no give on this side. And springing the left sit bone outward, there's no give. Typically with this pattern, people typically present with a side bent coccyx, but her coccyx is symmetrical. I'm pulling up on both sides of the coccyx, looking at the sulcus against the transverse process, and that is symmetrical. So there's no coccygeal tailbone problem. So I have other videos on the lower windswept pelvis. I have other videos that show treating it. And I think what we'll do is stop filming right now. We'll come back and show you the benefit of treatment. But basically what we do is we stretch this part of the body. We stretch it to the left. Nope, I got that wrong. Basically, we stretch her left hip to the right. We stretch the right hip outward. Okay, hip pelvis. We stretch going into external rotation of the right hip and pelvis. And then we stretch into external rotation on this side, and we do 2 minutes each of those. So I'm going to go ahead and treat, and we'll come back and we'll film the response to treatment. Thanks.